Welcome to Nami Finger Lakes Family Forum. Thank you everyone for joining us for tonight's program. I'm Executive Director Beth McGee. Nami Finger Lakes is your local affiliate of the National Alliance on Mental Illness, the nation's largest grassroots mental health organization dedicated to building better lives for the millions of Americans affected by mental illness. Locally, NAMI provides a helpline, support groups, education, and advocacy opportunities for families navigating mental illness. All of our services are free. This event is being recorded and will be available on the NAMI Finger Lakes YouTube channel soon, where you can also find our previous family forums and other events. Before I introduce our guest tonight, I want to mention that NAMI Finger Lakes is recognizing Mental Health Month with several events. Our Spring Mental Health Awareness Virtual Challenge will run from May 1st through 8th. It's an opportunity to support NAMI Finger Lakes and to have conversations about mental health that help to end stigma and barriers to care. If you would like to learn more about this event, please visit namifingerlakes.org/NAMI Challenge. We'll also have 2 opportunities to participate in NAMI Family and Friends, which is a 2-hour presentation that touches on many of the important topics from our signature family to family class, such as diagnoses and how the brain works, medications, communication skills, developing empathy, NAMI resources, and much more. We're also sponsoring free Zoom yoga sessions to support full body health and mental well-being with Verdi Kelbreth on Wednesday evenings throughout May. And we'll also sponsor an author event with Buffalo Books on May 27th, so watch for details on that. I'll place a link in the chat to our most recent newsletter on our website, so you can find information about all of these events. So thank you for your patience during these announcements. And now let's welcome Harmony Ayers-Friedlander, Tompkins County's new Deputy Commissioner of Mental Health and Community Services Director. These are important positions for our community and of interest to families navigating the mental health landscape with our loved ones. Harmony began in March, and we're grateful that she's taking time so soon after her arrival to share her perspective with us and to learn about our local NAMI community. Harmony, I think I'm going to go ahead and let you introduce yourself. You'll be better prepared to do that, I think. And then Harmony will be presenting a PowerPoint presentation with us this evening. And then after that, I have some questions that I'll be sharing, and then we'll have an opportunity for a Q&A after that. And you can submit your questions in the chat. So please hold your questions until that time because I don't want them to get lost in the chat. Okay. Welcome, Harmony. Thank you for coming and visiting with us. I really appreciate it. We're really looking forward to this conversation. So would you like to go ahead and share your screen now, or would you like to introduce yourself first and go ahead and do that as you wish?
I think I'll start with sharing the screen.
Okay.
And then hopefully you can see, I think you can see me as well, correct? Everyone can see me. So basically, I have lived in Ithaca for many years, but I have often worked in other communities. I had for a brief period of time a private practice for children's counseling services. So that's really the area that I know well is children's services. But I saw that this position had been open for a period of time and felt like it was really the right time in my life to be able to be committed to something in my local community, which I really, really love. So as Beth mentioned, I've only been in the position since March. So there may be questions you ask me that I will say, I don't know, and I need to get back to you. But I think that will be good for me because it will help me learn more about the services here. I really love Ithaca. I love the community. They take the issues of mental health, substance use, and developmental disorders very seriously. And I think they're always trying to be creative and innovative in the context of many, many barriers that you are well aware of. I wanted to also talk with you tonight about the community services plan, as you can see on that first slide. Every community is responsible for developing a community services plan that is submitted to the state. And that plan, it's really helpful to have as much community feedback as possible. So I was really hoping to get a lot of information from you. You'll have some questions for me, but I have some questions for you. And your input in this plan is going to be vital for it to be a good reflection of what our needs are. And I thought to start with that, I could do a little bit of a history of why does every community have a community services plan? Who came up with that idea? And why do we have a local government unit? Why do we have someone like me, a deputy commissioner of mental health services here, but also the director of community services? What does that even mean? So I thought I'd start with a little bit of that history for you. Basically, New York State has this law called Article 41, it's mental hygiene law, and it says that every county, and then New York City, of course, has its own special rules, has what's called an LGU, or local government governmental unit. And it's responsible for making sure that we have all of the mental health services and developmental disability services and substance use disorder services that our community needs, and that they're done in a coordinated way. And then the director of community services, and that's who I am, is charged with making sure that this community services plan is completed, and it identifies our biggest priorities in the community with some goals about how we're actually going to try and chip away at those big priorities every year. And that I am supposed to go out into the community and get feedback from people. So our current system of having that LGU, that local government unit, which is the county, and the director of community services and the community services plan comes from a deep history. And I think understanding that history helps us recognize some of the ways our systems have failed in the past and some of the attempts to correct those. And while not perfect, hopefully better than where we were in the past, and hopefully can inform how we can get better in the future. So really, there's been a 66-year history for the LGU and the DCS being created with this community service plan. And I'm going to go over it in a matter of 5 minutes. So hold on, we're going to go pretty quickly and talking about how this all started. And it really began with that shift in institutional care to community care. And many of you, I'm sure, are aware that in the past, in 1955, we had over 93,000 people in New York State alone who were in institutional settings. And you can see from this graph where we were in 1955, then where we were in 1984, and then how we keep chipping away and getting smaller. And New York State established the local government unit in 1977, and then created the Mental Health Reinvestment Act in 1993. And by 2017, we went from having almost 94,000 people to 2,300 people in institutional care in New York State. So that whole transitional period was challenging and with some serious problems. And the state realized that having people stay in institutional settings for very long periods of time wasn't a good solution. And they wanted to try and figure out how can we serve communities, people in our communities, so that they can live among us. So that whole attempt at trying to find a better solution started in 1955. And today you can see where we're at. But it was not without pain, and it is not without problems. In 1946, President Truman signed the National Mental Health Act, which included a significant amount of funding for psychiatric education and research. The National Institute of Mental Health started in 1949. And in 1954, New York State adopted the Community Mental Health Services Act. And that was really designed to try and create more community mental health services. And the costs of those services were going to be borne by the state and the county, and they were going to be equally shared. So that's where we were at in the mid-50s. In 1963, we started the first wave of national deinstitutionalization, or that moving people out of institutions where they were living for long periods of time back into their communities. And that started in 1963 under President Kennedy, who made the National Community Mental Health Act. And at that time, there were 500,000 people living in these long-term settings, right? And the average length of stay was 11 years. So they really knew that there needed to be some change. So the intent was to try and create these community resources for people so that they did not need to stay in large institutions away from their community. And so the federal government gave funding to the states to try and create different solutions. But the results weren't good. They really weren't good. Only half of the 1,500 community mental health centers that were supposed to be built ever got built. They were never fully funded. The act did not provide enough funding to continue. So if someone built the program, it wasn't funded from the get-go completely, and then there was no sustainability built in to continue to provide funding for those programs. So when the federal grant dollars ended, many of those programs that were put in the communities were cut. But unfortunately, also the state had closed all of their expensive state hospitals and programs they had without putting those dollars towards the needs of people in the community. So while we didn't have a system that was working very well before, we now had a very fractured and fragmented system that was completely underfunded. So the problems were lack of continuity of care, and people who were seriously mentally ill were really failed by these, at the time, progressive policies that people were trying to implement. So that was during the 60s and the 70s. And I think it's an interesting time to think about these issues, not just from why is there a director of community services and a local government unit, why was that created, but also from the perspective of a lot of emphasis then moved to our correctional institutions and police departments and sort of this criminalization of mental health problems that we also experienced, right, where people were being put in handcuffs and treated like they were criminals instead of having health needs. And that was just a lack of, maybe there were a lot of unintended consequences to these policies that were designed to do something good, and they really created a lot of pain for people. And I think we're still living with that burden today to a certain extent. So New York State looked at it and said, this national problem requires a local solution. They said that the complex needs of individuals, how on earth is Washington, D.C. going to know how to support them? How are we going to know what people really need in case management and housing and all of these things that impact people's lives? How would Albany even know those things? It really needs to be done at a local level. And so they created the local government unit, and they created this local community services plan and charged someone with having oversight of that process. So that's how it all started. And this local community services plan is done every year. And it is an important document. I think sometimes for people who look at it every year, it can feel like, well, these were the problems we saw last year, and they are intractable and they are big. But the idea behind this plan is that if we can all work together collectively, we can do a heavy lift and chip away every year at what may seem kind of insurmountable this year. Where are we going to be in 5 years if we keep working at it together in our community? It sort of gets everybody on the same page so that we can try and make things better in our community. And I like that it's local because I don't think people far away can ever understand the culture and needs of a community the way people locally can. I lost my mouse. There it goes. I had to find my mouse. Sorry about that. So the powers and duties of the local government unit really are to administer the services that people need and to create these long-range goals and intermediate range goals of things that we're going to work on regularly as a community. And that plan is then submitted and approved by the Community Services Board. And This plan does a few things. It's designed to make sure that we have sufficient services in our community, that those services are coordinated, and that there's good continuity of care. The plan is also influenced by plans that the state puts together and influences the state's plan. So one of the things that the state will tell you is how many other counties identify the same kinds of needs you did. And the state looks at all that data across all the different counties and says, oh, well, most of the people are saying this is a big issue. Then when it's time for the grant cycle, they're going to look at those things to be things that they want to fund. And then it helps us figure out how to prioritize, right? We could just be going a million different directions for a million different problems because there's no shortage of supply of problems, right? But it does help put us all together and say, these are the priorities we're really going to attend to. And it helps local stakeholders and the county government, maybe people who aren't as close to the work as all of us in this room, it helps them understand here are the big needs of the citizens in the community that need to be addressed. So the process includes looking at a lot of state data, local data, and compiling that, listening to local voices, and that's what I really want to hear your voice tonight. And then putting it all together, creating these goals, and then monitoring. And I think monitoring has been one of the pieces. For us, it's always been a challenge, right? Because you want to make sure you're measuring your progress, you create goals that are realistic, things that you can achieve in a year, that ever so slowly we will chip away at these big mountains and improve our local services. So it has to have all four of these pieces in it. And need is what you're really looking at. So to figure out what are the needs in a community, it's looking at prevalence. How big of a problem is there? How many people maybe you're calling the suicide prevention crisis line potentially, right? That would give you a sense of prevalence. How many people are making calls and what's the kind of information that they're sharing on those calls? And then what's our capacity in the community? Do we have enough services? And are those services being utilized? So it's really important to find out if we have services, but they're not being utilized. Why is that? Do people not know about them? Is the referral process too challenging? How can we maybe smooth the way so we don't maybe need more services? We need to improve some processes in those services. All of those questions have to be answered through this process. And they ask at the state level, they ask every local community to think about this from a zero-based planning idea. And that's like, yes, you had a plan last year. Don't think about your plan last year in the beginning steps. Just go with fresh eyes. And you guys are my fresh eyes because I have looked at last year's plan and the plan before, right? I need people with fresh eyes who are just going to come in and say, well, this is what my experiences in the community, what our needs are. So we're not so swayed from what we wrote down before that we never reconsider or think about what we're seeing differently. And then really, really get very disciplined about that focus. I love this book, The 4 Disciplines of Execution. Talks about our WIGs, or our wildly important goals. Pick the things that are really important. And if those goals are not achieved, nothing else matters. Really focus on the things that are going to push. Like one of the things I think about a lot is adverse childhood experiences, right? We know trauma is really a root cause of many of the problems we experience in our community. And should the goal be really focusing on looking at how we can reduce trauma in our communities? And adverse childhood experiences is only one type of trauma. The state's recognizing that one as a category, but we know that people experience trauma throughout their lifespan, and we know reducing trauma and creating more trauma-informed environments in all of our settings might be a really good goal, because if we address that, what are we going to change for people's lives in other areas? However, it gets decided by the many voices that I hear, and then I try and synthesize that data and reflect back to the community what the community has spoken. It needs to be really important, and it's going to shift other things for us. So next steps really from you is getting your feedback on what you see as the biggest needs. I want to hear your voice on that. And also let you know that what I'm going to do is I'm going to take notes. I'm talking to many people. Some people I'm going to do all the subcommittees of the Community Services Board. I'm meeting with them, and they have a more formal process because they're a part of that formal system that was established through the local government unit. But I'm also doing interviews with people. I'm doing other focus groups. I really want to hear from a diverse group of people in our community about what the needs are. And I think you you have a special wisdom because you have experienced firsthand what services work and when they don't work. And people, I think, who provide services, oftentimes, they're coming from such a different perspective. They can't share that experience. And I think that is a really important piece of this. If we want to make things better, it's good to hear from people who have used services. Eventually, all of this data gets put into a plan. It gets presented to the Community Services Board for approval. It gets sent to the state for their review and their approval. And then it's publicly accessible. If you just put in your like I think my cell phone knows everything. I just put in there Community Services Plan, Tompkins County. The plan will pop up. You'll get to see it. It's kind of like gobbledygook the way it's written, but that's how a lot of forms are written. But at the end of the day, it's what are your biggest priorities and what are the things that you are going to focus on? And in some areas, you just write comments to the state so that they can know, we don't really like how this is working. And that's good information for them to have too. And I know that they read it because then they come back and they look for those trends and those patterns. So I am going to try and figure out how to stop sharing my screen because now I'm at the end. They gave me so many computers in my office. I have so many screens. Sometimes I get confused as to which thing has the button I'm supposed to hit. So really I did. Look, tell me, what are the needs in this community? What are the big pressing problems that we are facing that we could do better in? And they think the things that if we could shift those, they would really shift other things for us.
Thank you, Harmony. I appreciate that information about the community services plan. I'm not seeing that when I Google. I just tried it on my phone and I'm not seeing that when I Google. So I'm just wondering what the most recent plan has been. I'm thinking it might have been a challenge to get that done during 2020. So just, it was good to know that it is done every year. And I have not seen it, so I'll be interested to take a look at that. And I was also really interested in the number of 90,000 people who were institutionalized in 1955. We say now, or we know that at least 1 in 5 Americans have mental illness in any given year or experience symptoms of a mental illness. And in Tompkins County, if we have 100,000 residents, that's potentially 20,000 people that live here. And so thinking about it in those terms, it's really kind of overwhelming when we think that 90,000 people in 1955 across New York State were institutionalized. And I don't mean to simplify that number, but that is the statistic that is shared all the time. And if, we often will say, well, if you're in a room with 10 people, there's at least 2 people that are experiencing this in their life right now. And, to kind of help us better understand the people that we're communicating with. So that's a lot. That's a lot potentially in Tompkins County that we need to address these issues for and advocate for. So I do have some questions that our board and other people have emailed. So I'd like to get to those first, and then I will take questions from the chat. And thank you for the book recommendation. I'm always looking for another good book on how to get things done. So I appreciate that. Um, okay. So a while back, we were interested in during our legislative agenda meetings with our legislators, NAMI advocates met with every single one of the state legislators or their representatives during the spring. And one of the things that one of our members mentioned is that we're very worried about caseloads in Tompkins County, and particularly now, especially now that mental health is mental health conditions, they're more prevalent, especially after 2020. So we're really concerned about caseloads and what that does to morale in the mental health clinic, and also the leadership changeover that's happened quite frequently at Tompkins County Mental Health, and the challenges that that presents for staff. And so how will you be addressing that morale issue and helping people who are working there um, uh, have a better sense of well-being themselves and feel better about the work that they're doing and have access to resources to do it?
Yeah, that's a really good question. I feel like nobody has gone through this crisis unscathed. Um, and I also am anticipating that as hopefully as we move through this pandemic and we start to turn the corner and our fear around our physical health, that people who maybe have just been holding on are really they're gonna have a kind of experience, and then they're gonna really be overwhelmed with a lot of the mental health grief and loss and just holding on it with so much anxiety. I really anticipate that we're going to see a lot greater need in our community, and that doesn't exclude therapists, right, who have been facing these challenges like everyone else. So I think the morale thing is always out there, but especially now, given how difficult it's been, that is even more pressing. So there have been a number of things that I've experienced in my short time here. I find the people I meet here to be very connected and caring with each other. They do something called the soft landing, both for public health staff and for mental health staff, where they create a space for people to come together and share how they're feeling and how they're doing. And it's an emotionally safe place. We're doing as many celebrations as we can too. And they're a mixture of, you have to be creative, right? We just did something to recognize Social Worker Month last month. And this Friday, they're going to be having a big taco event for people. And you have to put all these safety measures in place, but that's going to be for administrative professionals. And the next month, it's nurses. And we have this new committee that formed that's trying to find ways to celebrate, connect, and link people. We did some surveys recently about how people felt about doing telehealth. And a lot of people found that that really balanced their work with their home life and felt that that was really positive. People felt they were more productive in many ways. And for clients that are better, their needs are better met that way, we'll be able to continue to operate that way. So I think there's a percentage of people that just seems to be a good way for them to get services for. And there's a percentage of staff who really like that. So the county is working on trying to find the best fit for each department, which is challenging because there are many different people in the county. But I think that has been a morale boost for a lot of people because there's more flexibility in their work. So I think those are helpful, but like you said, caseloads are high. That is an issue facing every public clinic in the state and probably in the country. It is a big challenge. And when you said that about the numbers before, how many people, 20% of the population in any given year, 50% in a lifetime, are going to have a diagnosable mental health condition. The reality is we can't treat everybody with a master's level therapist or psychiatrist, right? We need more of these services in our communities with peer supports. We need more casework supports. need more of the paraprofessional level. And I see this community really strongly looking at ways to address the needs of people through other mechanisms, and just it's not just going to be a clinician at a counseling agency that is going to be supporting people. And so being creative about who's the right person to respond. Some people that peer support person, that is definitely the best person. They would never walk into a clinic. But that person with lived experience is exactly the right person they need for support. So, and I just came from a meeting today where other agencies were talking about how they were creating more educational opportunities and really expanding peer support services. So I think we need to expand our ideas of who provides services, make sure that we're flexible in how we deliver services with the client's best interest at the heart of that always, but also recognizing how that flexibility can be supportive to our therapists and highlight and celebrate the hard work that they do. And also being creative about, can we move someone over in this role that might be a better place for them, a better fit, expand someone's hours a little bit, because, we're limited. We can't just go out and hire more people, right? There's a limit to our budgets. And so we have our financial constraints, but I think there's ways we can be creative about putting people in positions that maybe are a better fit, and maybe giving people increase in hours when we see that. I think we are anticipating pretty significant growth for children in particular. We're already seeing a pretty significant uptick in that. So trying to get ahead of that. I think by the fall, we're really going to see a lot of kids. This year was tough. And I think it was really tough also for me, young adults. You're just trying to start out in the world. And this is your understanding of what it means to be an adult, is this really unsafe environment. So I think we are going to have college students and also children and adolescents who are really going to be struggling quite a bit. And we're trying to look at ways that we can expand some of that service and be creative about it. It's never going to be perfect, and we're never going to have enough, right? But
well, I like to hope that we can have that be the prize our eye is on. And you did mention, I often worry when we talk about peer supports and utilizing peers more in care. Whenever I speak to someone who has this lived experience, I tell them they are an expert in their experience. And I really worry that that will become an adjunct exploited labor force that don't necessarily have a PhD or a master's in a mental health field. But again, we're relying on them a great deal, and the pressures on them to do that work while maintaining their own well-being will be even greater. So I'd like to make sure that we have some way of being really careful about that when we're utilizing that. And I do think it's really a terrific idea to have people who have this lived experience and sharing in this way, and encouraging other people that may not be as receptive or may not be doing so well at the time, to try to encourage them in their care. And the other thing that would be important, I mean, as family members, housing is such a huge issue. Sometimes it's just overwhelming for a family, and having positive housing experiences that are clean, that aren't substandard housing situations, is probably the highest priority for keeping people experiencing a mental illness safe and in the best situation to receive services and get what they need. And so kind of building the community that supports people will take up that slack of the 20,000 people that, if we can only treat or provide care services for, say, 2,000 to 3,000 of them. It's building that community and making that investment that supports and holds up all of the rest of those people so they don't fall into crisis. That would be really important to families, I think. So we have a really strong history of advocacy here. Nami Finger Lakes has been here for 35 years. Nami is a 40-year-old organization built on advocacy. And so I'm curious, if Nami Finger Lakes were to advocate for something for Tompkins County mental health, that would be to help Tompkins County mental health be the most successful at providing communities' mental health needs. What do you think that would be?
If you were to advocate for something?
To policymakers, funders.
Yeah. There's so many things.
Aren't there?
Oh, all right, let me try and like one thing. Well, I think we need more counselors, more of that. But I also think that figuring out ways to do better collaborative work and to enlist a system of support. Like you said, housing is this bedrock of support that people really need. I hear housing, housing, housing from everyone. And then having people around you that support and lift you up and help you feel good and that you feel like you're treated with dignity. And really having good collaborative services. Like how do we make, that's what I think about pretty much every day so far. And granted, it hasn't been long, but it's really about how to make things as collaborative as possible. No one has all the answers. As a community, collectively, we can do better in finding those answers and supports for people, whatever they might need. And I see the community trying to do that. And this is just a newbie's impression, right? New person. There's lots of good things happening, but is everyone talking to each other? And how to maybe enhance that collaborative process. And I think there are efforts underway to do that. So I would advocate for making sure that as we build new systems and create change in our system, that we make sure everyone is linking their services together with each other, and that takes time. That's hard. You have to have the time to talk to other people and find out who they are and what they do. And that's hard when you're really booked solid, right? And trying to find structures to make it as efficient as possible for people to be able to support each other's work. And remember, as we create new things, which I think this community is really on the edge of doing, that we know that there needs to be a hub where it comes together. I hope that makes sense. I can't say that it's one simple thing that here's the big, but that idea of not to forget that it takes an entire team with unique skills and we need everybody talking to each other.
What are your thoughts on crisis stabilization centers, a place where people who are in crisis can go that is not a police car or jail or even the ER, and be able to leave that experience with the information and the connections that they need for all of the things that they need to have a healthy life and work toward recovery. What are your thoughts on that and the possibility of that in Tompkins County?
Well, I have a meeting this Friday with OMH, and that is on my list to tell me more about those services. It does look like there's going to be some funding from the two COVID relief packages, the one in December and then the one that just was passed more recently. And the state looks like they're going to focus on mental health services for adults, children, and crisis services. Those were the three areas that they're focusing on. But the state is really right now collecting feedback from people. I have looked at the crisis stabilization model. I think it's important that crisis be looked at holistically. You need to have as many programs as you can that are coordinated and linked together to keep people out of crisis and to prevent crisis and the reoccurrence of crisis. And you need to have places for people to go that are safe when they're in crisis. And that may be one of the best models out there for this community. I think there's more to be seen about that, but that's definitely something that I think people are looking at, because we do have a problem with the revolving emergency room as our option right now. And there are other options that looks like that are out there that could be good. I think there are a few other ones. The crisis stabilization is the one that sort of pops out to me, but I think it's going to be something to really reflect on. What are the pragmatics of it? What's going to be funded? And is that the best model for us? I couldn't say exactly, but it looks like a very promising one that I have been looking at. So yeah, because we need front end. I feel like we do really well with the middle of the pool, right? The deep end, not so much, and the shallow end, like that prevention focus piece, and how to help support people who have many needs and complex needs. We need to get better at both of those ends. We tend to do well. It's sort of like the teacher who teaches the middle of the room kind of a thing. It's easier to go right to the middle, but we need to make sure we have a system that's got a good, robust continuum of care for everyone. And that as much as possible, we keep people out of crisis. Because when people are cycling in crisis after crisis after crisis, there's no opportunity for growth, change, wellness. And that's where we want to get everyone.
When someone is experiencing crisis over and over, they tend to be seen as a burden on the community and difficult, or a burden for us to figure out what to do with them or how to deal with that. And as family members, I think it's really important to us that we look at this community of our loved ones as people that have value to add to our community and deserve our commitment and care to help them live their best life. Just as we have in the medical field at the hospital, where we do everything we can to get someone to the best health status that we can before we let them out the door. So really understanding as a community that, for instance, a person who has a brain tumor and a person who has a brain disorder both have physical brain health issues, but one is treated very, very differently. How can we bridge that gap in this community? What can we do to make that different?
I think that COVID, if there's something good from it, is that I think there's an opportunity to reduce some of the stigma that surrounds mental health, because everywhere you go, you see commercials now with football players and basketball players and people talking about having depression or anxiety or a mental health condition, and that it's okay to seek out help. And I feel like younger people are in a very different place than older people. So part of it, I think over time, it's just going to get better. I think people talking about it, and like this group here, talking about your experiences, people need to talk about things and not feel ashamed. And when there's a realization that all these people I know and care about, well, they have these problems, and there's no shame in having that kind of problem, it makes it easier for other people to talk about their problems. And the more people can do that and connect and see their humanity and each other's humanity, I think that will change how we treat things. Right? Because at the end of the day, society has to decide how they want services to look. And if you think that someone's lesser than, you give them less service. And we can't get people to stop thinking people with mental health concerns are lesser than unless they start to see their face. I feel like you can look at other groups of people that have experienced a lot of stigma, and that shift came when people started to say, that's me. There's power in saying that's me. And I do think you see it in younger people. They don't have the same hangups. They really don't. And someday they're going to be voters. And I've noticed the research shows that younger people are becoming more active in voting at a younger age. And they're not waiting till their mid-30s before they really start to take it seriously. So maybe we'll get this really good group of younger, committed, passionate people who will help. Maybe the younger people will have to lead our way here towards that change. But you have to change people's attitudes. And you change people's attitudes when they know somebody and care about somebody and say, oh, you're okay. I know you.
Mhm. Could we count on Tompkins County Mental Health to do some messaging in that regard?
Yes,
in the
I mean,
community?
yeah. I'm
Public
sorry, I didn't mean to
messaging,
cut
not
you
just,
off. You got
no,
me
public
excited.
messaging,
Yes, yes.
not like amongst our own organizational conversations, but more public
I
messaging.
just actually had an email today from someone in the public health department. So that merger really helps it a lot because they do a lot of public health messaging, and they were bringing on some ambassadors for public health messaging and said we'd love to do some public health messaging around mental health. And I said, I'd love to meet them. Let's set that time up. Let's do that. I think that messaging helps. The more people see, every email I get from the state says, if you're stressed out about COVID, here's the hotline, right? It changes your perceptions when you have media messages out there. And the one thing public health department has, the mental health department doesn't have until we get ourselves organized with this merger, is they have expertise in marketing and messaging. And so we'll be able to utilize that more, and hopefully as things settle down with COVID, we can actually focus messaging on more things like that. And I was just talking to someone yesterday, I think, about messaging needs to be done for different audiences. If I am a homeless person, what kind of messaging do I need? Maybe I don't have access to social media. Maybe that's not the direction for me. But if I'm a 17-year-old and maybe I'm really stressed out about, like a cyberbullying situation, I may need a social media, and figuring out who are the populations that we really want to target messaging towards, and then what are the tools that we should use for those. And having somebody with expertise in that is really exciting, because I think we can do a lot more of that. Once we get a little bit farther along here and getting everyone vaccinated and all these things that have sort of sucked all of our time.
Maybe we could get a grant from some funders to wrap some TCAT buses with some good messaging or something.
That'd be great, wouldn't it?
Yeah.
Yeah.
So speaking of young people, we're often really concerned about young people that are in transition from being under their parents' care to becoming an adult with their own ability to express their desires and control over their mental health care. What are your thoughts on that? What are ways that we can help be better supports in our community to young people that are transitioning in that way? It's really often very jarring and alarming to parents or grandparents who are caring for their young children or their young adult children. And then all of a sudden in a day, it takes a drastic shift in what parents can do. So what are the types of connection services that we can do in the community, especially through mental health, maybe through PROS or some other community program like that through mental health, where we can really help families build on that relationship together as they get to, closer to that time. It's just it's a very difficult, it can be a very difficult time if trust relationships have not been built. Just curious about your thoughts on that.
Yeah, that's a good question. I can remember when my kids suddenly, right, like you were the one who made all their doctor's appointments, and you were the one that you were a part of all those conversations. And you might be the first person someone calls with your adult child when they're in crisis, yet you're powerless with much of the decision making. And I think what you said there is that if those trust relationships haven't been established, it can be really difficult, because somebody who's younger may want to experience that freedom, but they haven't yet got the responsibility, or they may not have the understanding necessary yet. So it would be, and I'm not sure how they do that here, but like I said, I was a child and adolescent therapist for many years. So I think you have to work with family systems. Individual treatment is really helpful and especially important. Kids need to have a voice and a safe space to go, and they need someone they can really just confide in as they're trying to find their way. And let's face it, sometimes parents, we can overreact to things, or we're not going to have that professional separation that they may need to be able to explore their thoughts and feelings about something. But if you see that this time is going to come and this young person is going to be dependent on their parent for support, working through that and discussions with them together, I think would be really beneficial. If there's an opportunity to do some group work in the future, that might also be a helpful thing, because it is a challenging thing to navigate. I want to be independent. I still need you. I don't like that I still need you kind of state that people are in, and the parents suddenly feeling very vulnerable and powerless, and that's a whole new experience. So I think having, maybe as you see that time is approaching, therapists would bring them together and start doing some of that work together and put some of that out on the table. How are you going to manage this? What if this scenario existed? What would that look like? What kinds of releases would need to be signed, right? Because that is a huge barrier right there, right? I can't talk to you because there's no release. I could yesterday, but not today. And to do some of that prep work ahead of time and get that stuff taken care of. Someone can always change their mind, right? Child could get angry at a parent and rip up the release and say, I don't want that anymore. But at least to try as much as you can to create that relationship and keep communication open. There's a lot of times with teenagers, you're saying to them, geez, I think your parent might want to know that. Mm-hmm. You're not going to tell the parent, right? You try to get the child to tell the parent with you there. That's a big part of working with adolescents. So that skill set is something you can take over into that young adulthood.
Yeah, and that's actually a good transition into the next question. There are some proposed changes to the HIPAA law, privacy policy in particular. And I believe that the public comment period has been extended maybe through the end of this month, I think, on that. But those, the proposed changes could be very helpful for families, especially if you have a pattern of a person who has had hospitalizations at multiple places. It's very challenging to get that information between the different entities and to provide best care, potentially to know potential dangerous treatment or medication choices that have been made before that would be difficult if they were tried again, or a waste of time. And also communicating with family members. And right now, I am able to be collateral support and call and provide information. But I can't be much more supportive than that unless it can be a somewhat of a two-way communication with regard to what a provider thinks the person that they're treating might need and that a family could provide. So I'm wondering what you think the proposed changes might do for us as a community in providing better care, or if you support those changes, just what your thoughts are on that.
I saw that there were changes coming, but I have not read them in depth yet. So that sounds like something I'll put on my to-do list. I know it's been a challenge for a number of years now. They've created the RIO, people are trying to get information to help support all sorts of health emergencies that a person might have. And it's really been a struggle for substance use providers in particular and mental health providers who can get information out of these systems, but not put information in those systems. So I think, this to me personally goes back to the stigma idea.
Mhm.
This information is so super private, like all this other health information about you is at this level, but this information is so private because if anyone knew, shame, that there would be a lot of shame for you. So we keep this in a separate little box. It kind of feels like that to me. So I think we have to look at privacy rules because we need to treat whole people. And if we're treating their medical issues and we need that information for emergencies, the mental health emergencies, substance use emergencies, we also need to find ways that we can provide adequate care for people and use information that would be available if it were another kind of emergency situation. And that's really the RIO's one big benefit, is to create better coordination of services among providers. And then if you went somewhere and you had a health emergency and you couldn't speak for yourself, that somebody could get into that system and find out all the different things about you. So I do think we need to make changes, and we need to make it easier for people to get access to provide good care for people. And we need to have guardrails on whatever it is, because some people can be very well-intentioned in some families and other people may not be. There may be a history of abuse. There may be reasons why somebody wouldn't want all that information shared. So we just need to make sure there's protections too.
Okay. And speaking of families' involvement, what are your thoughts on families participating in mental health care and treatment plans for their loved ones? We of course believe that it is primary in helping in the best recovery opportunities if there are healthy relationships. We don't always feel like that is welcomed when we're working with mental health organizations or hospital situations. And we're really sometimes in the best position to support and care. And I understand that it can be challenging, especially if there aren't releases. But I know that sometimes we can't even get beyond the receptionist desk if we don't have a voluntary loved one. We can't get supports just as a family member calling to find out, what can I do? What can I do to get help here? So if you want to share some comments on that.
I think one of the biggest places a family could be a help is if there's safety planning. A good safety plan in particular should be asking about who are your supports and who do you lean on when you're in a tough situation, and how do you lean on them, and really get some clarity on that and make sure that that person's a part of a plan. When I've done safety plans with people, I will say to them, well, okay, you've identified, and sometimes it's a friend, sometimes it's a family member, whoever somebody really relies on for support is invaluable to their treatment, and having them call that person right then and say, hey, I'm talking right now, I'm adding you to the plan, if that's okay with you, and getting that person, like, I think you have to engage people and pull them in so that they can be a part of that process. I think it goes back a lot to shame for many people, that they don't necessarily want, how you were saying before that society can look at someone as a burden. I think people absorb that, and then they can feel like they're a burden to their families, and they may resist wanting to have their families involved because, one more time, I'm being a burden. So exploring that with people to find out, how do you know that? How do we get someone involved at the level that might be right for you? can we try something and see how it goes, and see if you can pull family in. It can be challenging, and I think in certain such settings it is even more challenging. So I'm thinking about like a therapist office, right? How you might do some of those things with a person. And if you're going to a facility or something, and if a person's in crisis mode, it may not be the right time. If the person has feelings of shame about seeing a loved one right then, it might make them feel worse right in that moment. They might, so it's important. For a brief period of time, I worked in a substance use program, and there was a period of time that they really wanted people to sort of step back, sort of collect yourself. You knew the person was safe. They needed to sort of really focus on themselves a little bit and get comfortable and stable enough and think through how they wanted to communicate with their family and address maybe a lot of hurt and a lot of painful issues that need to be addressed. And they needed like space and time a little bit to be able to do that first. And families sometimes need to do that as well. For many years, I worked with children who caused sexual harm, and it was a pretty difficult path for many parents. There were times when parents were like, I can't even look at my child right now. I don't even want to talk to my child. I'm so angry. I'm so hurt, especially if it was a crime against a sibling. And there would need to be a space of time when they were apart from each other. So, and then bringing back together, not too long. It can't be too long. People may need space and time, but not so long that then it becomes very hard to bridge. So I think it's so dependent on the circumstances. Is it going to be benefit to that person right then in that moment? I think the thing that gets forgotten is that parents are part of the work too. The pain and fear and unknown and powerlessness that a parent can feel needs to be supported as well. Even if there's no easy answers, or even if now's not the right time to be a part of the process, I think we can always do better. It just feels like everything's so rushed. There's so much time pressure because the needs are so great that sometimes it can feel like your concerns, I don't have time for that. I can't be bothered with that. And sometimes it's just hearing something like, your child loves you. I know they love you. They said they love you. Right now is not a good time for them to talk with you because they are really in a state of upset, and they don't feel like they can see you right now, but I know they love you. Like, just messages can make a big difference, even if you can't be a participant in that point in time. And there are barriers, but hopefully we can find ways to work around them. But it requires the time and tenderness to do it well.
Thank you. I am going to just ask one more question that I have here. And if people who have questions want to start putting them in the chat, I'll also save the comments from the chat and collate them and send them to Harmony. So any ideas that you have that you wanted to share that aren't necessarily formulated in questions that we'll talk about tonight, she's asked for feedback. And so if people want to share that in the chat, I will collect that and send it along to her. Let's see. There was. So at Nami, we focus on the impact of mental health conditions of our loved ones and the impact on our families. What are some ways that Nami Finger Lakes can partner with Tompkins County Mental Health to improve outcomes for people living with mental illness and their families? We've talked in the past about doing maybe something with PROS, just one of our programs, for instance. We have many offerings, many educational opportunities at NAMI that we have support with, and so I'm curious. Of course, we'd love to communicate with you further about what those opportunities might look like. But what are some things that you think we could help the clinic with.
Yeah, I have this look on my face because I'm trying to remember this book I read. There's a company in California called IDEO, and they're a design company, and they design a lot of incredible things to make work easier. Like sometimes they found ways to make things in countries where they don't have electricity to keep babies warm who otherwise would need to stay in a hospital for a longer period of time because they needed a special, like, they're those kind of creative people, not me. I have no idea. I'm more like mechanical kind of creative things. But one of the things they also do is they talk about having people go through your services and tell you about those experiences. So you can spend a lot of money hiring professionals like them, and they pretend to be clients, and they'll go to a hospital and they'll go through the whole process, and then they tell you what it felt like for them. But I imagine this room has a lot of that feedback already, and it would be good to hear that feedback if you've had experiences with us. What made you feel cared about? What would have been better? What should our waiting room look like? I mean, it's right now, it's all a mess with COVID, but it's what does the building say to you? How does it feel to come in the door? How would reception respond to you? What is it like to get a phone call, or don't you ever get a phone call? Or, I think feedback like that and some sort of maybe small group, or people could just answer questions like that and talk about their experiences would help a lot. Because when you're in the day-to-day of any job, you start to forget what the lobby looks like, or the receptionist talks to you differently than they might talk to a client, right? And it's okay if it's bad. It's good to hear the good. It's good to hear the bad, right? Because you've got to figure out ways to make that process better. And this famous company, that's one of the things that they do is go and immerse in the experience of what it is like to be the customer. And you are the customer, and we need to serve the community. We need good customer service. So even if you're not the patient, or the client, you're part of that process. You have experiences there. I think that feedback would be really helpful. And I'm not exactly sure how we could do that, but something like that kind of feedback would be really helpful, because we frankly just don't really know. You can do surveys with people and see if they're satisfied and that sort of thing. But having people tell you what the whole feel of a place is like, how welcomed, how warm or not warm. There were no toys for my child to play with when I came in here. Things like that matters, right? Mm-hmm. But I'm sure there are other ways, and it sounds like you have a good list. So I'm excited to hear about those ones.
Okay. If anyone has questions they'd like to add to the chat, you can start doing that now. I did have one comment that I received, said, we're fortunate in Tompkins County to have a mental health clinic. Unfortunately, the clinic has incurred a poor reputation in the eyes of some families of loved ones. One issue has been therapist high turnover rate. Also a sense of therapist unwillingness to think out of the box and to try new approaches. What do you know of these and other problems that need to be addressed, and how might you address them?
Well,
we did have some high turnover in the last year of therapists, and it's very challenging for our loved ones to figure out, then all of a sudden the person they may have connected with is no longer there. So that's just one more aspect of that.
Yeah, I saw that before I started, that there has been a lot of high turnover, and that is certainly a challenge. And you get attached or connected to somebody, they know your story. You feel comfortable with them, you feel safe with them, and suddenly you're doing it all over again. So that is never a good thing. I'm hoping some of those things that we've done around flexibility and scheduling, some of the things that we're trying to do to create an environment, and these things all started before I got here. I'm not taking credit for any of them. I think there has been a lot of work to really rebuild a team that felt demoralized. My sense of it from the people I've met, and of course, I'm just starting, but people tend to tell me what they think. I get not always like warm and fuzzies, right? People tell me when they don't like something too, which is great. I want people should just come in and tell me how it is. That's the kind of person I am. I want to hear that because we can always do better. And I'm hoping that there's a culture here where people feel safe and supported and cared about, and that it is not just in these activities and these specific kinds of things, but it is something that permeates the space. There is a lot of turnover in this field. It is high burnout because the caseloads are high, because public clinics tend to work with highly complex clientele with many needs. And so it can feel overwhelming for therapists. So having regular supervision, making sure that people are feeling supported, and there's that piece where you're like working on getting your paperwork done and making sure you're meeting regulatory compliance. And then there's that space for you to just really talk about your own vicarious trauma and your own frustrations. I was a clinical supervisor for a number of years, and I would have therapists come in and like do yoga poses while I wrote notes. And I'm like, that's what you need to do. If you need to go stand in the corner and yell for a while, please feel free. Like people need a space where they can just go and sort of process some of those things. So there is that soft landing, but there is also regular supervision with a focus on that, processing their experiences in the work. That's really important. It can't just be, they have a meeting, they've organized things where they have a meeting where they talk about more like, here's a new policy and procedure, here's how you do this piece of paperwork. But the regular, and they do that on a monthly basis, but the regular supervision is around them processing the challenges of the work. And I think that will help. As far as somebody being rigid in their work, I don't know the specifics of that situation, but if you're feeling strongly about that, that's something to say. I want to know who your supervisor is so I can touch base with them, because I think the supervisor can help with that that particular kind of issue. And I think some of it goes to personality. I've seen therapists who, this is how I do it. I always do it like, this is the sheet I use to do this kind of activity, right? And I want everyone to do the sheet as a supervisor, say, and that's not going to ever happen because everyone does things, the goal is to address this topic maybe in treatment, but people are very creative. Therapists tend to be very creative, and they're going to do it in multiple ways, and it needs to reflect the individual needs of your client and your skill set that you bring to the table. And group supervisions also can be very helpful. So even talking to a supervisor, you're not saying, I want to get this person in trouble. You could say, I really think that this could be done a different way. I feel like there needs to be more flexibility. That supervisor could have people look at that, whatever that topic is that they're going to probably do with more than one client, and have a whole group of therapists talk about ways that they do that. And that could maybe help that one person be more flexible. But so I would reach out and ask to talk to the supervisor. You're not complaining, you're saying, I think maybe it could be done differently.
Okay, thank you. I'm not seeing any questions in the chat box, so it must be we're getting to all of the topics that people are interested in. But if we are not, please be sure to submit your questions. I did wonder, you mentioned in your discussion about the community services plan that listening to the community was going to be really important going forward. So what opportunities will you offer for people to connect as a community with TCMH and to provide that feedback? Whether it's maybe, I don't know, something like town halls or, some sort of informational listening sessions, I guess the OMH is calling them right now, which chime into the listening session on April 30th for our region about the block grant that we got. So what would those opportunities look like?
Well, there are a few people that I'm learning everybody in the community like this, right? It's so new. I'm still learning who everyone is. So the subcommittees, so the Community Services Board has subcommittees in each of the specialty areas of substance use, mental health, and developmental disabilities. So they're doing a big chunk of the work. They tend to have a lot of really well-informed people on those subcommittees who may be in the field and that sort of thing. So that's one part. I'm also going to interview with people that, as I go to meetings, I might say, oh, that person has maybe a different perspective, or I don't. So I want to reach out to religious leaders, Veterans Administration leaders, school leaders, people that I'm not finding on these other subcommittees. So some of them I might say, well, that person's in a position, maybe I just want to sit down and talk to them alone, just get their perspective. So I'll probably do that with 2 to 3 people. And then I want to create, like you said, a listening session or a focus group, and then open that up and really do an invite to a broad sector of people. So what I have said to people that I know so far is, tell me who's not in the room. And then people can give me names, that sort of thing, to hear from. And maybe I could advertise it on your site as well, right?
Yeah.
And put it out there at a couple of different sites. So I'm trying to, our plan is due July 1st. So it's not a lot of time.
Yeah.
So right now, all the subcommittees, I'm just getting them to get together in working groups and getting their feedback. And then I want to add that in with people, more voices from the community. So I will be sending that. I'll send it out to you and you can post it and people can come if they're interested. And if there are names, like if you're, put in the chat, I want to be a part of that group. That would be great, because it really needs to be a diverse group of people that just bring a lot of different perspectives. Now, Beth Harrington knows from the Suicide Prevention Coalition, I'm hoping there's a section that's new to the community services plan that's specific on suicide prevention activities that I'm hoping that group is reformulating to ask them a few questions in their next meeting as well. So there might be committees or groups that I go to. I also go to a lot of meetings where people are just talking about their needs and they're not necessarily knowing that I'm like, oh, need. And I just jot it down when I hear and what person said that. So a lot of people are giving me their feedback and other meetings not knowing they're giving me feedback. So trying to grab it from every corner I can, but I'm hoping to have like 2 focus groups and 2 to 3 people that are just individuals that I'll just get their feedback directly from.
Great. That sounds like a good slate of opportunities to get some feedback. I do have a question. What is the plan to address trauma-informed care at the clinic and create a trauma-informed organization?
Well, I have to find out what they have been doing around the trauma-informed care topic to see what kinds of activities they have put in place. I know that most therapists are well trained on addressing trauma. If you're not working on trauma with your clients, I would be really concerned. But it's bigger than that, right? It's the entire environment. And that comes to some of the questions I was saying. What does it feel like when you come in the door? How do you feel people treat you? All of those components. So there is an assessment tool that I was working with prior to coming here in the agency where I worked before. And there are 11 different categories, trauma-informed, to have a trauma-informed agency. And you can join different collaboratives where they walk through agencies, because you're going to look at your documentation. You're going to look at what it feels like when someone calls you and reminds you of an appointment. You're going to look at how we treat each other, right? That's a big part of it. How do we help support people who experience vicarious trauma in the workplace? All of those different components to a trauma-informed environment. You can do an assessment. And then there are You could be in it with a group of other agencies that are working on it collectively. So something like that would probably be a good strategy, I think, because you can learn from other organizations, even if they're different kinds of organizations. Sometimes communities might pick to work together, like the school district, maybe the Department of Social Services or the courthouse, or a whole businesses can say we all want to be more trauma informed in our approach, and they can do it like as a collective group going through a process of being more trauma informed. But it begins with an assessment and then selecting particular areas you want to focus on and learning about those. But being part of a group where it's systematic, I think would be very helpful, and learning from other agencies going through that process.
Okay. It's been a while that we've been, like you said at the beginning of our discussion tonight, that we've been looking for someone to fill this position, your positions. So I don't want to put, a lot of pressure on you here tonight to carry the entire burden of all of the achievements we might make going forward. But I do recall from the presentation that you gave last week that you talked about monitoring and measuring what we're doing and evaluating that for best outcomes. So could you talk a little bit about what that'll look like for you going forward at the clinic with regard to all of the things that you hope to work on there?
I'm glad you brought that up because I did take that slide out. I was afraid this one got too long. So what slides can I take out? These poor people are going to be in a coma. So it's really important to me. I was on the community services board for a number of years, and one of the things that I had always wished for was that there was some yardstick, and we were saying, how are we doing on these issues, right? And they're big. Right? If you put down housing as an issue you're going to focus on, it's very easy, I think, to get hopeless on that. Because our community in particular, that is a very, very big challenge. So I think the plan, you come up with your priority needs in the plan, and then they have these objectives sections. And the objectives is where we have room to do things, make them observable, measurable, things that we want to do. I just sent an email out we have a lovely person in our quality department. So that's one of the things mental health has that public health doesn't have, is we have this amazing quality department here. And I wrote to her and I said, here's the top priorities. I think that the state is going to say that the needs are, and I think we're probably going to say, can you help me get more data on it? And particularly, can you give me some guidance on how to take all this feedback I'm getting from the community and quantify all this qualitative data I'm going to get so that I can make sure I'm measuring it correctly? And can you give me some guidance once we get to that point of how are we going to create measurable goals? Because that's what she does all day long, is create measurable goals. I think we want to be very careful when we create this plan, is we can say, here's this big priority need, and here are the things that we can do, that we're going to work at doing. And then the subcommittees can evaluate them regularly, maybe every quarter. I'm asking them how they want to evaluate them. I've already talked to the subcommittees about evaluating them, but I want them to, it's their subcommittee. I want them to tell me how often they want to do it. But to monitor the plan and see how we're doing. And if we're not doing well with something, what are our barriers and what might we want to change throughout the year? So by the time we get to the end of the year, it's just, we don't make a plan and put it in a closet or a cupboard somewhere. We take it out and we look at it regularly and see, are we achieving these things? If we're not, what can we do? So at the end of the year, we know where we stand. And we might make some of those objectives and we might not make others. And that's okay. That will help us better do our job the following year. And I think it keeps people from feeling hopeless, because you can take big problems that are going to take a long time to solve. But if you chip away every year in a measurable way, by saying, in the next, 3 months, we are going to do A, B, and C. And then we're going to see how that worked. And then after that, we're going to do this. And have a few. And if we break them up, the biggest issues in our community are going to be across the different services. And then maybe one committee is working on something and another committee is working on something else. I think that will help. And then get support from whoever can help us in the community, because I'm not going to do the work alone, right? It's a community endeavor. And the subcommittee members know other people that they can bring in to help do that work. People that participate in that process, it would be good. To have, here's our update, here's how we're doing. And maybe we need to find a way to make that transparent, what we're doing and where we're at. It's still a work in progress, but I do know it has to be. I want the people that are helping develop the plan come up with those ideas. So hopefully in the next few weeks. But at the end of the day, you do what you measure.
Mhm.
So it's important that you actually have a yardstick. And that book that I talked about in my presentation said, go play a game of basketball and don't keep score and see how it goes. And then start keeping score and see how people play differently.
Mhm.
It really does matter that you measure things.
Yes. And I think we definitely have put those resources in place for measuring data and collecting data in Tompkins County. So we'll be interested to see how that unfolds. And so I want to be mindful of your time, and you've been very open this evening in sharing. We did have one comment that collaboration in Ithaca would certainly need to include the homeless shelters, Loaves and Fishes, Liberty Resources, the street outreach team, and organizations and landlords who will rent to persons with special needs. And this is like a support network that will, something like this, real collaboration, can help us hold up something like the crisis response that we're looking at going forward. We can't be successful with that endeavor. Or even like the 988 implementation is really envisioned to be a crisis hub, like you spoke about before. And so all of these things coming together, that's a huge project, but it's absolutely necessary if we're going to move ahead with the recommendations from the Reimagining Public Safety initiatives. I think that they just specifically spoke about transitioning to a cahoots style model for crisis response, community crisis response. So I'm just, if you'd want to talk a little bit about that.
I'm trying to find the question.
Well, I'm just wondering, how are you feeling about that, knowing that you've just come in say a month ago, and or almost 2 months ago, and the county has made a decision to really transition things in a really big way. So I'm just, I'm wondering how you're feeling about that. If if the gears are already moving with regard to that, and if you'd like to share a little bit.
Well, I'm trying to remember that. Okay. Yes, my gears are. I got all these pieces of paper on it. It's exciting. I'm not attached to anything.
Mhm.
I think that really is helpful to be new at a time of change, because I'm not clinging to any way things used to be. I'm just learning how they are, knowing that they could change tomorrow,
Mhm.
and reading as much as I can and pulling out documents that people have done. This community has done so much work, and I think some of it got lost. I'm trying to find this one particular report because I never can say the name of it right.
Oh, is it the mapping one?
The sequential intercept
Yeah.
mapping one. I
was
love
going to
this.
ask you about that.
Everything in here, like you can see, it's all, I don't know if you can tell, it's all highlighted. Like I got to find the spots that are not highlighted. So I think this is a wonderful time to start a new job, because you can be really creative and you can look at, wow, this community, first of all, the community is way ahead of government, right? This year has just well, I feel like we're still in the year of COVID, so I see no distinction between this year and last year. This time of COVID has really created so much greater awareness of where our systems are failing and where we as a society have to do enormous work on recognizing systemic racism, how to be more inclusive, how to become the people I think most of us want to be. And I think it's been a jarring time for people, the economic crisis, the health crisis, this incredible social awareness for many people about how we have failed at the systems level to treat everybody with the respect and dignity that they deserve. And we're in this moment of potential great change. And I think it's important to look at what happened in the 60s. They were in that moment and they thought they were going to be doing these really wonderful things. And we are still paying the price for their mistakes, the unintended consequences of some of their decisions. So I think this policy work, how it gets laid out and what we actually put in place has to be very carefully done, has to be thoughtfully done, and we have to consider things that we haven't thought about before. And what's really important to me is that no matter how that process unfolds, you have to think about whose voice is not in the room, who has been made invisible by this process. Because those people were made invisible when deinstitutionalization happened, right? The people that were most to suffer were never asked or heard from. No one ever considered, do you have housing? Does your family have a space for you to come live? It was just assumed, right? Because when we make people invisible and do things to people instead of with people, we end up with all sorts of messes. So I think it's an exciting time, but I also think it has to be carefully done. And that we are always asking ourselves, who are we not listening to? Who is not at that table? The most invisible people are the weakest and usually the ones that are most vulnerable and get hurt if we don't hear their voices and their concerns. So I think we have an opportunity to be really creative and maybe fix some of the things that have been broken for a really long time. I don't even remember your question anymore. I hope I answered it after all of that.
No, that's great.
But this plan is just wonderful. And I was in meetings where
it?
people said, no one remembers it. I'm like, oh, they must. It was so well done. And
well, I was actually a little disappointed because at one of our family forums about crisis response, one of our Nami members has been reminding me about the sequential mapping since I started last March. So I've read the whole plan and I mentioned it at one of them. And then like at the next county meeting, the link to it was up. So I was really excited that they were sharing it. And it was like, well, we've already done so much of this work. We've already decided on priorities, in that program and of work. So it really is very informative, and it is available online, the Tompkins County sequential mapping process. So a lot of those these things that are in our priorities have already been worked out. That doesn't mean they don't change. You do your community services plan every year based on what's in front of you now. So but it's definitely a really good introspective by this community about what the gaps are and how we might approach them for solutions. So I was going to ask you for some closing thoughts, but your last answer was so eloquent and you shared so much there. So, but I'm happy to give you an opportunity to give some closing thoughts before we end tonight.
Just thank you for letting me be a part of this community. I live here with a lot of pride. This is an exceptional place. It is not a perfect place, but it is exceptional. People care deeply about each other. I am so happy to be a part of this mental health community and look forward to working with you over the years ahead and strive to make things better. and to celebrate our successes together. And we will do that by measuring some of our things that we're going to look at. And please give me your feedback. I am really interested in hearing what your ideas are and hope to synthesize those. And if you want to be a part of a bigger group on that, I would love to add you. Thank you.
Great, thank you. And I know at Nami Finger Lakes, we look forward to connecting with you and getting to know you better and working with you and collaborating with the mental health clinic in any way that we can to improve outcomes for the community. So if people want to stay on for just a minute after we're done here and put any comments in the chat, I'll keep it open for a few minutes just to collect those. And then I will share them with Harmony after the event is over. So I thank everybody for attending this evening, and Harmony for taking this time. We really appreciate you, and I think that's it. All right. Take care, everybody.
Good night, everyone.